program is brought to you in association with First National Bank of Botswana. The world has now gone full steam ahead in economic activity following the devastation of the COVID-19 pandemic. After almost 3 years of living with economic and health restrictions, life has now gone back to some sort of normal, with most countries lifting such laws as wearing of masks and presenting COVID vaccination certificates at port of entry. Even though that is the case, the devastating aftermath of this deadly disease could never be denied. A slow global economic recovery, mass losses of skilled manpower and key businesses that could not stay afloat during tough times. While we look forward with hope, we must also look back on lessons from the pandemic that might help us predict what the future might be like. Hopping on to have that discussion with us is pharmacologist and consultant cardiologist, Dr. Kiran Bhagat. Doctor, thank you so much for coming on First Issues and affording us your time. We are talking today post-COVID lessons, right? And in my humble opinion, the focus has been, as regards anyway, the impact of COVID-19 has been on businesses and the workforce, maybe even adults, but not much attention was paid to children. Perhaps today we could talk about, the impact on them.
I think that's an important subject, and you're right that during the lockdown and the principal issues of the pandemic have been focused on the middle-aged and the elderly, because these are, from the infection perspective, from the viral perspective, those that were at greatest at risk. And now with, letting our hair down, taking off the masks and the consequences of the post-lockdown, we're beginning to see some of the effects in children, in adolescents, in teenagers. And the effects are mainly the mental, traumatic, emotional, psychological effects that we see as a result of the lockdown. And if one understands that children, by nature, be it primary or secondary school children, have developing brains, and these brains need exposure. They need people, they need interaction, they need social activity, they need to see the face of the teacher, they need to see their friends. Teenagers, interact more with their peers and their parents, take advice from their peers rather than their parents, need that social interaction, need that peer group activity, need to go out and explore. And these things were matters that were locked down to them, if you like. So they were sitting at home, whether they had COVID or not, primarily amongst the youngsters was not relevant, because they overcame it very quickly. And we know that children with COVID, it was simply a flu-like illness. So they didn't really concern themselves with that. And even post-COVID, we're not seeing too many long COVID symptoms in our young population, which basically means the consequences of COVID. But what we are seeing are the traumatic effects that of the mental anxiety that occurred in the younger population. We're talking about preschool and primary school. We're seeing, or teachers are describing, a lack of the ability to socially engage. Particularly if you're in your first year of nursery school or primary school, and you're used to seeing a teacher, and then suddenly the teacher wears a mask. And you can't see the expressions of the teacher. You can't see the pronunciation by the teacher. You're hearing words that are blurred. You can't see whether the teacher is pleased or displeased with you. You can't see the smile of the teacher. And so the lack of that social engagement, the lack of that emotional connection at a nursery, kindergarten or primary school level, teachers tell us has had an impact in the socialization of these primary school children, in terms of them looking down rather than looking at the teacher. There's no engagement. People were communicating at a teenage level by cell phone rather than interaction. And so that social engagement appears to have been affected substantially. And psychologists tell us that we're not sure whether these will have long-term effects going into secondary school and university in terms of how they interact with their peers. In terms of the teenage group, what we are seeing, and I see that in our clinic, as we see some of them coming to us for cardiac problems, is they have been locked out of interaction, and so they've used or become abusive of the cell phone. You know, there's the social media, there's a Facebook, there's an Instagram, there's a Twitter. And so these have been the means by which many teenagers have been communicating. And it has resulted in a lack of the ability to actually debate, for example, or to stand up in a class and talk to other students, or to go and sit a written exam in front of other students. It was, you know, usually an exam that you do online, or you do it, you know, without anybody there. And so this anxiety, the ability to have social anxiety is demonstrable in some of our teenagers. Some of the lockdown effects have actually also triggered underlying mental illnesses in those that are already predisposed towards anxiety or depression. And we see generalized anxiety disorder, we see panic disorder. We see in some teenagers who have suicidal tendencies for whatever reason, because we know that during the lockdown there was a much greater risk of child abuse. You know, never mind spouse abuse, there was child abuse. The children were being locked away because parents were afraid. Parents died, so the child had to come to grips with being the head of the family, taking more responsibilities. This is what is unfolding in terms of the mental trauma in teenagers. We've seen teenagers cutting themselves, basically where you cut your wrist to bleed. And the reason why teenagers are cutting themselves is that pain induces a sense of, it releases the body's natural opiates that give them pain relief. And that pain relief gives them some sort of comfort, love, and security. And so we've seen suicidal, parasuicidal tendencies in our teenagers. We've seen the ability to actually not maintain their temper tantrums, abusive, violent behavior when they've normalized back into society. Some of our teenagers have become addicted or adapted to the use of substance abuse to kill the time, for want of a better word. And so these are the effects that we're seeing in some of our teenage group populations. That having been said, I think it's important to understand also that those teenagers and youngsters that were affected by the COVID infection themselves is something that is also neglected, and the same population in adults that were at risk, those that were diabetic, those that were overweight, those that ate the wrong foods, such as sugary foods and fatty foods, were also children who became at risk of getting the infection itself. Asthmatic children, children that were diabetic, that were overweight, children that didn't exercise because you couldn't go out and exercise, that put on more weight. So the asthma became worse, the allergy became worse, the food habits became worse, the addiction to fast foods became worse, because that was a quick fix to comfort yourself the fact that you couldn't communicate or go out and see your friends. So these are the effects that we've been seeing, and the effects that will have a long-term implication as our teenagers go into university and beyond, in terms of the impact of COVID and the lockdown.
Well, at this point, I'd like to find out from you what lessons you think have been learned for moving forward.
I think the lessons we've learned are still being accrued, but I think from my point of view as a cardiologist, I think the lessons we've learned, particularly in the adult and I suppose some of the younger teenagers, is look at the ones that sadly did succumb to COVID. Look at the ones that have long-term consequences of COVID, and those are the ones that didn't exercise before COVID, that ate the wrong foods before COVID, that became diabetic because of bad eating habits, that didn't shed their weight, that didn't sleep well, that didn't manage their chronic disease, whether it was asthma, whether it was allergy, whether it was diabetes, whether it was cholesterol. So we know that these are pockets, whether they are older teenagers, younger adults, or middle-aged people. These are the ones that really need to button down and make sure that their lifestyle measures are taken care of if they want to prevent, because COVID has not gone away. It has simply gone into abeyance. And so we are going to see COVID come back again. And if it does come back, God forbid, in another form, we need to be prepared in terms of lifestyle measures. And this really has been the cornerstone of us managing our COVID victims, that get on your bike, lose weight, make sure your asthma is well controlled, control your eating habits, cut the sugar, stop the inflammatory foods that you're taking. In children and in teenagers, we need to learn to be better capable of ensuring socialization in terms of activities, in terms of distraction, getting out there, outdoors rather than indoors, behind a computer or behind an iPad or a phone, in terms of those social skills, getting better sleep for teenagers, ensuring they have the right food, particularly, those that are boarding out there in secondary schools, ensure that the diet program, the exercise, the counseling programs are there for our children in the future.
So speaking of the future, how does it bode?
I think the future bodes well. I think we've learnt our lessons. I think certainly the WHO and other major organizations have started what are called sentinel posts, which are posts that actually pick up changes within various viruses. We've talked about, recently there's been the monkeypox and new variants of COVID. So we now know that we should be on the lookout all the time. We should be on the lookout in terms of people having nasty infections. We should be on the lookout in terms of how to clamp down, how to trace and track a particular individual. So I think in terms of our ability as humans, we've learned very quickly. The other thing that I must add is as much as there is much fake news and junk news on social media, the vaccine industry, the drug industry in terms of how we treat COVID has been propelled hugely, and it has benefited us in terms of our ability to produce a vaccine, to modify a vaccine, to create new vaccines, the malaria vaccine, the cervical cancer vaccine, brain cancer vaccine. So these are spin-offs from the vaccines that were used, the technology that was used to make the COVID vaccines are now being used for many other purposes. So our ability both within the laboratory and in the pharmacological drug industry and the vaccine industry has been propelled forward in terms of the silver lining from that epidemic. So there's lots that we've learned, and I think we shouldn't forget, because now that our masks are down, it almost appears that the public has forgotten about those terrible times we had for almost 2 years, literally not a couple of months ago.